This is where the Public Servants Association is picketing outside the Vryheid District Hospital. The PSA claims a doctor who worked at that facility took his own life after repeatedly complaining about systemic bullying, amongst a series of other issues. The association is now calling for an investigation into Dr Francis Idika's death. And Newzroom Afrika's Silethiwe Ndlovu is live for us from Vryheid. Silethiwe, there were strong sentiments from some of the representatives there expressed about this being a historic and systemic issue at the hospital, and those complaints falling on deaf ears. Have we heard from any officials so far this morning?
Unfortunately, Iman, as it stands, we haven't heard anything from officials. I know that a lot of them are inside at this particular moment, but none of them have actually come out to speak, even to the PSA members that we have here outside. But as you have already mentioned, the PSA does state that the doctor then allegedly committed suicide due to a number of issues, particularly when you're looking at systemic bullying that had been happening. They also claim that over the past 5 years, there were disciplinary charges that had taken place. And we know that he had been demoted twice before his untimely passing. But I just want to bring in Newzroom Ndlovu to speak to us more. Perhaps, firstly, just some of your concerns. I know that the PSA released a statement where you mentioned that there was managerial tyranny and also a systemic failure, rather. Talk to me about that.
Yeah, we do know that there are processes that take place in each and every department, especially when you are charging somebody. But some of these processes were not followed, which left the doctor frustrated. And we're saying that there's been an alleged committing of suicide because of the manner where the doctor was treated, which was very unfairly. And we know that some of the things that stress people in the workplace is how they are treated at work. More especially, we do know the position of the doctor was often higher than the person who was actually supervising him. So those are the systematics that are not correct that are done here in the hospitals, which are leaving people frustrated and bullied, because when you take somebody who's junior to supervise somebody who's in an ESCO, and when you're not in an ESCO, what happens in that? That's why people exercise power when they want to prove that I'm in control, now I'm in charge. So we also feel that the doctor was targeted due to the number of events that took place since 2019 that showed that there was some bullying that was happening, and the way that he was treated, even when he was chased out of the hospital flats where doctors are supposed to be staying, and he was made to stay now in a park home, and that's where he passed away.
Just talk to me maybe about some of the things that he said to the PSA before his untimely passing. What were some of the concerns that he had raised, particularly about the hospital?
Yes, he had raised a lot of concerns that he was very frustrated about the manager and the management of the hospital, how he was treated and how he was treated differently from other people. Let me give you an example. The flats where the doctors are supposed to be staying, it's a clinical apartment where clinicians are supposed to be staying, but he was removed, and he's the only doctor that was removed there. But currently now there are HR and financial manager who's staying there, but they're not even from the clinical, so they're not supposed to be staying in those flats. So you can see that he was targeted, because why was he removed? And the manner of which he was removed, it was very, very brutal.
Maybe just to talk to me about your concerns looking at the overall scope, perhaps of the healthcare system that we have, not specifically in the province, but the country as a whole, particularly when you focus on mental health issues.
There are a lot of issues. One of the issues are emanating from the fact that we've got a lot of people acting in post, and posts are not filled with permanent people. And with that, it results at people oversizing their power, and oversizing their power is their own reaching in other people's professions. And with that, we've seen a lot of people coming with depression, not going to work because And there's many instances, even in Prince Msheni, we've experienced the same. Even 2 weeks back, we had a same case also in Benedictine Hospital, where people cry to say we are bullied at work, we are stressed at work, and we're not getting the support that we're supposed to be getting from the departments. And even now, we've been calling for the MEC, we've been calling for the HOD and everybody, but nobody has attended to our cry. So it's like they're ignoring these things, yet they know about them.
Maybe just to focus on the conversations, I know that you're mentioning that you feel as if your concerns are falling on deaf ears. When was the last time you made an inquiry with the department, and what was the response there, if any?
We made the last inquiry on Friday. There was no response.
Regarding this particular case, or just healthcare in the province?
Regarding all the issues that we're experiencing in the healthcare, because this is not the only case we're experiencing. We're experiencing so many cases, but there's been no answer.
Lastly, before I let you go, I know that you are set to hand over your memorandum. Maybe just to highlight some of the things that you are going to be demanding later on. I know that you are planning to speak with the MEC for health. Speak to us about that.
One of the demands that we have is the investigation that we want to be done on the death of the doctor and what are the issues that emanated to that. And one of the other issues is actually the filling of post, because all these issues are emanating from that, because people are just acting, and nobody's filled the post so that proper people manage properly. So those are just the 2 of the issues amongst all the other issues that we have.
Nondumiso, thank you so much for speaking to us this morning. That's Nondumiso Ndlovu speaking to us about some of the concerns that will be raised later on when they hand over their memorandum. And as you heard, Iman, from that conversation, they are alleging that the doctor allegedly committed suicide after facing a number of challenges over the past 5 years.